Hello everyone and welcome back. My name is Dr. Ben Osevwe and today we are talking about dopamine. Dopamine is often called the pleasure chemical, but that is only part of the story. Dopamine is not just about pleasure. It is also about motivation, learning, attention, movement, and deciding what matters. Short disclaimer. This video is for education only. It is not medical advice or treatment guidance. Part 1. What is dopamine? Dopamine is a neurotransmitter involved in reward, motivation, movement, attention, learning, and salience. Think of it as the brain's internal messenger, carrying signals between nerve cells to coordinate complex behaviors. These signals form the foundation of our drive and our ability to perceive meaning in the world around us. Salience means the brain deciding, this is important. A simple way to explain dopamine is, dopamine helps the brain notice, pursue, and learn from important things. Think of dopamine like the brain's highlighter. When dopamine works well, the brain highlights things that matter. Food, relationships, goals, learning, safety, and rewards. It signals to the brain that these activities are valuable and worth repeating. This reinforcement is key to survival and achievement. When dopamine is dysregulated, the highlighter may mark too little or too much. Part 2. Low dopamine effects. When dopamine signaling is too low or underactive, patients may experience low motivation, low pleasure, fatigue, poor focus, brain fog, psychomotor slowing, low reward sensitivity, emotional flatness, difficulty starting tasks. This can show up in clinical depression, making even the simplest daily activities feel like insurmountable hurdles. It is also a central factor in ADHD, Parkinson's disease, substance withdrawal, or as a result of certain medication side effects. A patient may say, I know what I need to do, but I cannot start. That is not always laziness. Sometimes the motivation system is offline. Fun analogy. Low dopamine is like pressing the gas pedal and realizing the car is still in park. Part 3. High or dysregulated dopamine effects. Too much or poorly regulated dopamine can contribute to psychosis, hallucinations, delusions, paranoia, mania, agitation, impulsivity, risk-taking, addiction reinforcement. In psychosis, dopamine may cause the brain to assign too much meaning to ordinary things. A TV commercial may feel personal. A stranger laughing may feel threatening. A license plate may feel like a secret message. Simple analogy. Dopamine is the brain's highlighter. In psychosis, the highlighter may start marking the whole page. Part 4. Dopamine and medications. Dopamine is involved in several psychiatric treatments. Antipsychotics often reduce dopamine D2 receptor activity. Stimulants used for ADHD increase dopamine and norepinephrine signaling. Bupropion affects dopamine and norepinephrine. Dopamine agonists used in Parkinson's disease can sometimes cause hallucinations, impulsive behavior, or mania-like symptoms in vulnerable patients. Provider pearl. Too little dopamine can flatten motivation. Too much dopamine can distort meaning. Part 5. Patient-friendly explanation. You can say, dopamine helps your brain with motivation, reward, movement, attention, and deciding what feels important. When dopamine signaling is off, a person may feel unmotivated, distracted, impulsive, or in some cases may misread reality. Outro. Today we learned that dopamine is not just the pleasure chemical. It is the motivation, reward, movement, attention, and meaning messenger. The main message is, dopamine helps the brain decide what matters. But when it is too low or too high, symptoms can appear. For support, text 83299916516. Subscribe and join our mentorship family at rotationmatchnetwork.com. Visit rotationmatchnetwork.com today to find your preceptor and join a community dedicated to your growth and professional excellence. Join thousands of other providers who are already part of our network. Let's make a difference in patient care and clinical education together. Thank you for watching, and I look forward to seeing you in the next video. Goodbye for now.